Hello and welcome to Docplexus News. Let's discuss this week's healthcare headlines that matter. The Supreme Court has agreed to examine a plea of doctors challenging the service bond conditions for super specialty courses. Several states have introduced a bond system at the time of admission, under which aspirants have to remain in service for 10 years and are liable to pay 2 crores as penalty if they break the bond. According to a statement by the Union Health Ministry, the cutoff percentile for NEET-PG and NEET super specialty exams has been reduced by 15%. The decision is thought to benefit about 18,000 aspirants and also improve the chances of filling up PG seats and minimize wastage of seats. The United States Trade Representative had requested Indian government to not expand price controls to additional medical devices. India has rejected this request as price controls form part of government's agenda to improve India's dilapidated public health system and boost affordability of treatment. FDA has issued a warning that lamotrigine can cause a rare life-threatening immune reaction called hemophagocytic lymphohistiocytosis. FDA recommends physicians to evaluate patients who develop fever or rash and promptly discontinue lamotrigine if such serious adverse reaction is suspected. In order to check the wide misuse of oxytocin, the center has restricted its manufacture and sale for domestic use to the public sector. The makers of oxytocin formulations will directly supply to the registered hospitals and clinics in public and private sector. Oxytocin in any form or name will not be allowed to be sold through retail chemists. The Union Health Ministry has finalized following format for government hospitals, with the dual goal of improving service delivery and ramping up infrastructure. All government hospitals will be automatically impaneled under the National Health Protection Mission. Reimbursements received from the trust or insurance companies for NHPM beneficiaries will be credited to the hospital's account and used for its own upgrade. And a fixed amount of about 15% will be distributed among doctors and staff of the hospital. The Delhi High Court questioned the need for having 24 hours long shifts for doctors in response to a PIL initiated by it after perusing a news report on the rise in violent attacks on doctors. As part of its directions, the court directed to assess the quality of working conditions of medical professionals at 3 hospitals in Delhi. The Allahabad High Court has expressed serious concern over appointment of doctors in administrative work instead of patient care. The response comes after a petition was filed by a doctor who had demanded clinical work but was posted in administrative department instead. The court said that the appointment of doctors is basically for patient care and they cannot be deprived of their basic work. The PC-PNDT Act was enacted in 1994 with the aim to curb female feticide. Due to various shortcomings of the Act, the IMA had demanded certain changes in the Act such as graded punishments for violations, and the non-obstetric ultrasound centers will not be required to register anywhere. In this regard, we conducted a survey to understand doctors' opinion about impact of PC-PNDT Act. The survey shows that 77% physicians feel PC-PNDT Act failed to improve India's child sex ratio. 72% physicians feel clerical errors in filling Form F should not be listed under major violations. And 84% physicians feel PC-PNDT Act has resulted in reluctance to install ultrasonography. We thank our community for an overwhelming response to the survey. You can also make your opinion matter by sharing your opinion in comments below. These were the latest happenings in the medical field brought to you by Docplexus, India's largest online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!